The full title of this presentation is Tooth Decay from a Dentist's Point of View. Please don't let the title discourage you. This topic is not for dentists. We are going to have an adult conversation. This presentation is especially for the parents, teachers, and caregivers. Even if you are a single young adult, one day you'll be given someone under your supervision your dental recommendation. Your recommendation can be as simple as brush your teeth twice a day and floss daily. However, this recommendation does not explain the why. Imagine telling a young child that he needs to brush his teeth and he asks, "Why?" Quote, "Why, Mom? Why must I brush my teeth?" Unquote. A legitimate question from an intellectual point of view, but this is not the reason why a child would ask this question. However, a legitimate question nonetheless. Imagine you give the standard answer, quote, "because you will get cavities if you do not brush your teeth," unquote. Then the child replies back sarcastically and says that he did not brush his teeth yesterday and he doesn't have any cavities today. Well, that's a parent's nightmare. The child's logic is actually very sound because he lacks the knowledge of the process, the dental decay process. The dental decay process is what we will be discussing for the next hour, so that you will have the ammunition to answer the most sarcastic question. A brief explanation on how I will use my terms. I may start out with a topic using technical jargon, such as Streptococcus mutans. But I will replace it, in this case, with a non-technical word, such as bacteria, to make it easier to visualize the dynamics of the discussion. The purpose of giving out the technical terminology is so that you will have the tools to obtain more details on the subject with an internet search. Without having the technical term, then any future research that you may pursue could prove fruitless. In this example, there are approximately 750 different bacteria that could exist in the mouth, but we will be focusing on just one, Streptococcus mutans. As our discussion progresses, I will try to use less and less technical terms and finish with only using the non-technical ones. So, what is tooth decay? Decay is the process of tooth breakdown, and a cavity is the result. Now, I may use these two terms interchangeably, and if you want to be argumentative with the semantics, then I will not argue with you about the difference. However, be warned, the internet tends to use these terms interchangeably, so I will as well. So let's start with the basic tooth structure. We will only be concerned with the crown portion of the tooth. Enamel is the outer white layer of tooth structure. It is made up of a calcium-rich crystalline structure. It is very hard. In fact, it is the hardest structure in the human body. Underneath the enamel is the yellow dentin. It is softer and more porous, and it covers the blood vessels and the nerves of the tooth. So, knowing the enamel and dentin location and characteristics, looking at arrow number 1. Since enamel is so hard, it is common to see decay as being very small as it travels through the enamel. However, arrow number 2 shows that when the decay has penetrated into the soft dentin, the cavity enlargement within the dentin can accelerate, and if left unchecked, it can eventually invade the nerve chamber of the tooth. If you were to go to the internet to view images of tooth decay or cavities, then you would get plenty of pictures like the one that you see now. You do not need to be a dentist to determine if this patient has the process of tooth decay occurring. However, today most patients that I see do not have obvious decay. For example, here's a tooth that most likely does not give the patient any problems because the tooth looks and behaves normally. This is an x-ray of the same tooth, but as illustrated by the arrows, there is a darkness in the tooth x-ray image that is not normal. So this tooth was opened up due to the suspicious tooth decay, and the brown sustained decay that you see within the cavity preparation is exposed. The remaining decay was then cleaned out, with the unsupported tooth structure removed as well. As you can see at the bottom of the cavity preparation, you can see some blood coming from the tooth, because the decay was deep enough to have reached the pulp of the tooth. This tooth will now need a root canal procedure and a crown. We will not be discussing tooth restoration in this meeting. This is for another discussion. The point here is that this patient had tooth decay that developed without any obvious signs or symptoms. If we were to look at the fossil record, man first arrived around 3 million years ago, with modern man's arrival at around 120,000 years ago. Tooth decay has not been found in the fossil record until 10,000 years ago, and this so happens to coincide when agriculture was first developed. Our ancestor diets over 10,000 years ago consisted of vegetables, fruit, nuts, roots, and meat. They were hunters and gatherers. By comparison, the modern diet became more plant-based, consisting of high intake of carbohydrates like refined grains, potatoes, corn, sugars, highly processed foods, dairy products, and fats, with less emphasis on fresh, whole foods. From 1947 to 1949, a group of patients in a Swedish hospital for the intellectually disabled were fed copious amounts of sticky sweets as their daily meal to promote dental caries. This was done to determine whether carbohydrates affected the formation of cavities. The experiment was considered a huge success, scientifically speaking. During the 2 years of the study, the teeth of about 50 of the 660 subjects were completely destroyed. Keep in mind that as a scientific study, there would be a control group who would not be eating the sticky sweets, and the remaining subjects would have other variations of eating sweets to test for other results. So, for 50 patients, to lose all of their teeth out of 660 is a huge number for a 2-year experiment. One practical result of the experiment was found that it was better to eat sweets just once per week, rather than having the same number of sweets spread out over the course of the week. To this day, the Swedish people will only allow their children to eat sweets on a Saturday. Needless to say, today, this kind of experimentation would not be considered ethically acceptable. According to the World Health Organization, 1 in 4 U.S. adults have untreated dental cavities. Worldwide, Untreated caries affect more than 2 billion people, which is more than mental disorders, heart disease, diabetes, chronic respiratory disease, and cancer combined. I have a saying that I often share with my patients. The foods we eat, the bacteria in our mouth eats. The particular food group that is associated with tooth decay are the carbohydrates. Carbohydrates are basically sugars. The sugars are basically broken up into 3 groups. The monosaccharides, which are the simple sugars, such as glucose and fructose. The disaccharides, which are the compound sugars, such as sucrose. And the polysaccharides are the complex sugars, such as starch and fiber. So I will need to get a little technical here, but it is necessary to make my next point. Here are examples of the chemical structure of 2 simple sugars, glucose and fructose. So if we were to combine those 2 simple sugars, we would have the compound sugar sucrose. Notice that sucrose, the disaccharide or compound sugar, is made up of 2 simple sugars, a glucose and a fructose, that have been linked together. And next notice that the polysaccharide are a chain sugar molecule that are linked and branch. In simple terms, our discussion, we are dealing with sugars whether simple, compound, or complex. So if what we eat, the bacteria eats in terms of carbohydrates, then how about digestion? In the human body, if we were to start with sucrose, as depicted as such, this sucrose will pass through the small intestines where it is broken down into 2 simple sugar components, glucose and fructose. Glucose will then enter the circulatory system and with the help of insulin will enter the body cells. Glucose is the needed fuel that our body cells require to function. Fructose, on the other hand, goes straight to the liver and is basically turned into fatty acids and triglycerides. So by comparison, we will look at how bacteria digest sucrose. The chemical breakdown of sugars in a bacteria is a little more complex than in human digestion. But in simple terms, when sucrose is provided as a food source, the sucrose will enter the bacteria. Then, with the sucrose within the bacteria, which is broken down differently than in human digestion, it will result in the same glucose and fructose. However, through a different chemical pathway, another component is also developed, glycans. The breakdown of the simple sugars, that is glucose and fructose, will produce an acid as a waste product, and the glycans will become the sticky plaque that adheres to our teeth. It is these byproducts, the acid and the plaque of the sucrose bacterial digestion, that we will now focus on in terms of tooth decay. We will first focus on the acid attack that occurs in our mouths after a meal. The amount of acid strength or acidity is measured on a scale of pH. Wikipedia defines pH as, quote, pH is measured on a scale of 0 to 14. On this scale, a pH of 7 is neutral, which means it is neither classified as being acidic nor alkaline. A pH value of less than 7 means it is acidic, and a pH value of more than 7 means it is alkaline. The pH scale could be depicted by the different foods and household products that we are accustomed to. Please note that water is considered neutral. It has a pH of 7. In 1943, a Robert Stevens first described what occurs to the pH in the mouth over time when we ingest sugar. Please note, I will be referring to this important curve in various ways extensively in this presentation. Stevens noted that when the pH drops below the pH of 5.5, meaning it becomes more acidic, the enamel of the teeth will start to lose calcium, which is called demineralization. That is, calcium is being removed from the enamel tooth structure by the acid when the pH goes below the value of 5.5. The pH will eventually normalize back out of the danger zone in approximately 20 to 30 minutes. Once out of the danger zone above pH 5.5, the tooth surface, being soaked in saliva, will have a chance to remineralize, which is a process that allows the teeth to self-repair from the effects of the acid attack. When we overlap the Stevens curves with different patient groups, we may appreciate at least one reason why some people are more caries prone. A healthy patient who is caries-free may not experience the pH drop in his mouth to fall below the pH of 5.5. However, someone with only a slight caries activity may momentarily drop into the danger zone. Most people fall into this category, whereas someone who is extremely caries prone may be in the danger zone for an extended period of time and possibly never recover out of it. Now, let's look at the Stevens curve on a daily basis for one person. This graph depicts eating several but separate meals, including snacks, but always allowing the time in between for the pH to recover so that remineralization can occur. By the way, I'm not encouraging snacking. This is just an example how we can still have a healthy dental condition even with snacking in between our main meal times. Remember, we are having an adult conversation concerning only dental decay, and this has nothing to do with best nutritional habits. A child would not appreciate the nuances of this slide. Imagine, quote, "Hey mom, the dentist just told me that I can eat snacks all day long if I wanted to," unquote. I can already hear the phone calls coming in now from all the parents. Okay, so now let's imagine the same eating routine, but adding coffee or a soda between meals, or snacking continuously and not allowing the pH to recover to the remineralization safe zone. This patient example has extended the period of acid attack. This does not allow for enough remineralization time for the teeth to fully recover. This unhealthy eating habit would definitely make one more caries prone. I see this many times with growing teenagers eating mom and dad out of house and home. especially if the teenager is playing video games all day long and continuously snacking. Now, let's add fluoride to this graph, or to at least end this example on a good note. A normal tooth would demineralize at a pH of 5.5, as we have already established. A normal tooth that has been previously exposed to fluoride, however, would need to reach a lower acidic pH, a pH of 4.5, before demineralization would occur. This translates into the fluoridated teeth being more caries resistant because the period of time to reach the level of demineralization would take longer to reach, and the pH should return back to the safe zone sooner. Obviously, this is the reason why we recommend fluoride in the water, toothpaste, and rinses. I would also like to point out that the difference between a pH of 5.5 and 4.5 is not 1. The pH scale is logarithmic, and therefore the difference between 5.5 and 4.5 is actually 10 times more acidic. That means the acidity will need to be at least 10 times stronger to demineralize a fluoridated enamel versus enamel that is not protected. Okay, so we have discussed the effects of acid attack. Now we will look at how plaque plays its role in tooth decay. We will start with a clean tooth surface. A pellicle formation will first develop on the clean tooth surface within 30 minutes. This is made of mostly glycoproteins that originated naturally from the saliva and the surrounding fluids. It acts as a lubricant for the tissue. It is a protective barrier, but it also acts as an unintentional substrate to which bacteria attaches. Next, bacteria attaches to the pellicle within a few hours. Next, the sticky plaque is formed, which allows the bacteria to proliferate. Then, bacterial colonization forms into complex group that allow acid to become more concentrated and longer lasting under the protection of the more organized plaque covering. At this stage, the bacteria acid is more protected from the saliva dilution and neutralization, and therefore becomes more destructive to the tooth surface. Plaque can contain up to 10 trillion bacteria per 1 milligram. That is a lot of bacteria. This photo shows the advanced amount of plaque buildup that probably took several days to accumulate from poor home care. There can be up to 400 to 500 different types of bacteria found within the plaque at the same time. Plaque is basically the glue that holds the bacteria in place on the teeth, which allows the bacteria to proliferate and organize. If there are lots of plaque present, then the additional acid production may exceed the ability of the saliva to remove the acid products. In this case, it may take up to 2 hours or more to neutralize or buffer the acidity, meaning the scales has been tipped in favor of demineralization destruction rather than the self-repairing process of remineralization. Please note that, interestingly, sucrose in particular is the only sugar that the bacteria can use to produce the sticky plaque. So now let's have a discussion about remineralization. Remineralization occurs when the pH has risen to a level where demineralization has ceased. Under normal condition, remineralization occurs above pH 5.5, which normally occurs for healthy individuals 20 to 30 minutes after finishing eating. Saliva plays an important role. It contains calcium and phosphates, and sometimes fluoride, that will restore the minerals lost during the acid attack. The pH of saliva is between 6.2 and 7.5, and this will help in buffering the acid attack from the bacteria in the mouth. We produce about 1 to 2 liters of saliva daily. Repeated remineralization over time will actually make the tooth structure even more caries resistant, especially in the presence of fluoride. Also, the teeth can become less sensitive as well. Since saliva plays an important role with remineralization, we should also discuss the properties of saliva. We basically have two types of saliva: serous, which is the watery type of saliva, and mucus, which is the thicker and stickier type. Next, saliva consists of 97% water, and the rest consists of many substances that are essential for digestion, dental health, and bacteria control. Saliva is basically your first line of defense against tooth decay by buffering acid, diluting and entrapping bacteria components, and presenting nitrates that help good bacteria compete with acid-producing bacteria. Some people will experience a lack of saliva, which causes what is called dry mouth syndrome or xerostomia. Low saliva or lacking saliva can put a patient at great risk of tooth decay. There are 4 common causes of xerostomia. Age. The older we get, either we have less saliva production or the saliva composition becomes less fluid and stickier. Medication. There are many common medications that have side effects of xerostomia. Radiation treatment. When presented near the head and neck, this can cause the salivary glands to shut down. Medical conditions, such as Sjögren's syndrome, can have devastating effects on saliva production. We will now discuss how to fight or prevent against tooth decay. There is an entire industry built on tooth decay prevention. The number of products and approaches are many, and so I will just briefly highlight what I feel are the more common and important approaches. So, we will start with the most important prevention method, and that is brushing. It is recommended by the American Dental Association to brush twice a day. In particular, it is better to brush before breakfast and before bedtime. Brushing before breakfast and not after is because to do it correctly after breakfast, you will need to wait at least 30 minutes to allow remineralization to have occurred. Otherwise, you risk eroding your teeth a little at a time due to the demineralization state of your teeth soon after eating. Many people are in a rush to start their morning, so waiting the adequate time to brush is not practical. There are a few brushing techniques that are taught to patients. Personally, I'm very biased in my approach. It may seem to conflict how many of you may have been taught, but hear me out. My first recommendation is vertical toothbrushing. Vertical brushing means one arch at a time, and initially placing the toothbrush 45 degrees onto the tooth surface at the gum line. You are not brushing the gums. You are brushing the tooth structure at the gum line. Your brush stroke is away from the gums. Many dentists and hygienists will teach a more circular tooth brushing. However, I am not initially in favor of this method because too many people will convert the circular to favor a more horizontal brush stroke, which can be harmful to the roots of the teeth and the supporting gums. I think of tooth brushing like sanding a piece of wood. You sand with the grain of the wood and not perpendicular to it. The teeth are sitting vertical in your mouth, and therefore vertical brushing would capture more of the tooth surface debris. This is an illustration of circular toothbrushing, which is how most patients are taught. This can be acceptable as long as it is not abused. The problem that I also observe often with this method is that people want to brush both arches at the same time, which may work on the outside of the teeth, but not the inside. So the inside tends to be more inadequately clean. Another problem is that it is much easier to turn this circular brushing into a horizontal brushing method, which is inadequate and can be destructive to teeth and gums. The areas that I observe most miss are the backs of the lower front teeth and behind the last molar, which makes sense if you strictly use this circular method. The vertical method is more of a place and brush, while the circular method tends to be a constant sweeping movement. Look at the two different brooms and think how you would use these types of brooms to clean your floors, sidewalk, grout, deck, etc. If you only had one broom, which broom would you depend upon to do the better job cleaning all the different surfaces that you may encounter? Personally, I prefer the smaller corn broom. It is more versatile in getting the job done well. Electric toothbrushes can be a godsend for especially the elderly and the disabled. It tends to foam up the toothpaste more and allowing it to penetrate more into the crevices. It tends to be more efficient. I can usually get the more aggressive people to back off from brushing too hard with using an electric toothbrush as well, which can also be a problem. And with the smaller head, it forces people to spend more time per tooth in cleaning their teeth. No hard toothbrushes. I tell patients to save your hard toothbrushes to clean the grout of your bathroom tiles. It is better to use a soft toothbrush with a small head to slow you down and pay more attention per tooth. It is generally recommended to floss daily. Now, I recommend with simple flossing using the middle finger as the anchor, as illustrated in the first diagram. You will have both indexes and thumbs available to hold at the proper angle depending upon which area you are flossing, as illustrated in number 2. You can use index to index, index to thumb, or thumb to index, or thumb to thumb, as illustrated in number 3. Some people prefer to use the floss sticks, which can be very convenient, especially for those who travel a lot or have poor manual dexterity. I prefer the non-waxy floss, but the wax floss is for people with very tight contact between their teeth. Floss setters are usually for those who need to floss under their bridges and under their orthodontic bracket wires. Sometimes some people complain that their floss always shreds or breaks. So I usually recommend a floss called Glide, which is made of Teflon and tends to better resist tears. Look for the ADA seal of approval on dental products. Some mouthwashes can help with tooth remineralization if the rinse is fortified with fluoride. I constantly get asked about rinsing, and usually it is because the patient is seeking an alternative to flossing. Rinsing is beneficial in diluting and buffering acid in the mouth, but it does not replace brushing and especially flossing. I recommend drinking water at the end of the meal. It may reduce the amount of food debris, dilute the number of bacteria and its harmful effects to the dental structure. For xerostomia patients with dry mouth conditions, I will recommend that they always carry a bottle of water so that they can sip the water throughout the day to keep their mouth moist and to receive at least some of the benefits that saliva usually provides. A water pick device is great for patients with braces and for people who constantly have trouble getting food debris stuck between their teeth. Cut down on sugars and complex carbohydrates in order to decrease the demineralization process. Cut down on snacking. Fluoride may help in protecting teeth. However, recent research has shown by far reducing a high sugar carbohydrate diet would be a great deal more important in reducing dental decay. Eat a well-balanced diet that is low in acid. Many times I will have patients who love to suck on lemons, not a good food habit to have. Also remember to give time at least 30 minutes or more between meals or any snacking to allow time for the teeth to self-repair through remineralization. Drink water after meals. Think about the benefits of saliva that is made up of mostly water. As discussed before, fluoride can help protect teeth against the acid attack from bacteria by making the tooth surface more resistant to demineralization from an acid attack. Fluoride can be found in our toothpaste, rinses, water supply, or can be described as a medication. There are many types of sugarless gum. I will talk about one type that contains a sugar substitute called xylitol. Xylitol is a sugar alcohol. The bacteria in the mouth will ingest it, however, it cannot digest it. Therefore, it reduces the acid and plaque production. Basically, the bacteria will starve itself. Bacteria levels can effectively be lowered, sometimes up to 75%. Chewing gum in general will also help clear away food and reduce the amount of acid in the mouth. Side effects. If you ingest large amounts of xylitol, such as 10 to 30 grams, you may experience diarrhea or gas. One xylitol containing Trident chewing gum only contains 1.8 grams of xylitol, whereas one spry chewing gum is 1.2 grams. But since I advocate only 1 to 2 servings after lunch, then the daily amount of xylitol ingested falls well below expected side effect levels. I bring this up only because I see many patients, especially young females, chewing copious amounts of gums during the day, which they could find themselves experiencing these types of side effects. pH of baking soda is around 8.3, which is alkaline. Remember, pH of water is 7, which is neutral. This alkaline substance will help buffer the acidity found in the mouth. I tend to recommend this type of toothpaste for patients with rampant dental decay. This can include adolescents with poor oral hygiene, elderly with loss of dexterity, and people with dry mouth conditions. 6-month regular dental checkup is normally recommended. Annual x-rays is usually for patients with low caries activities and history. Some patients may need more frequent x-rays. Consider dental sealants on young kids. Sealing their back molar pits and fissures to prevent dental decay in their new under-remineralized teeth. They say that you should practice what you preach. So what do? I will brush in the morning before breakfast and before going to bed. My focus is to keep the plaque down and allow all night for the remineralization to occur. Assuming I brush well the night before, in the morning I should have a pellicle formed already on my teeth and maybe have some attached bacteria as well. At this stage, the number of bacteria on my teeth should be low. By brushing my teeth prior to eating a breakfast, I will have again removed the pellicle and the bacteria attached. This sets my day to ground zero with the amount of plaque on my teeth. Please remember, it will take at least 30 minutes for the pellicle to reform and later a few hours for the bacteria to attach to the pellicle. So when I eat my breakfast, I will have little to no bacteria on my teeth. After eating lunch, I may have a thin layer of plaque starting to develop with the bacteria that is still sparse, disorganized, and unconcentrated. And saliva can still penetrate the young plaque well in order to buffer and to dilute any acid produced. This step is not absolutely necessary, but I like to improve my odds, so I will chew the xylitol chewing gum to stop or reduce the bacteria activity. After dinner, I may have a little more plaque than at lunchtime, but not significantly, where my saliva cannot do its remineralization repair. However, before going to bed, I cannot miss this most important time to clean my teeth by brushing and flossing. Basically, with this late night brushing, I am resetting the plaque cycle back to ground zero all over again. Should I dare miss brushing my teeth at this time, I will have allowed the bacteria to start proliferating and colonizing during my sleep. And because my saliva has some glycoproteins in it that the bacteria could feed on, the unremoved bacteria could still be able to produce some acid during my sleep, putting my teeth in jeopardy. I always recommend to floss at nighttime versus in the morning. Now, having a morning ritual is okay, but the problem is that for most of us, the morning time is a more hectic time of the day. How many of you would walk out of the house and say to yourself that you forgot to floss and would actually walk back inside to floss? The answer that I constantly receive from my patients is that almost all would continue to walk out of their house to start their day without flossing. This does not bode well in developing a good habit. So it is usually different with flossing before bedtime. You have less things on your mind and you are winding your day down. Also, should you slip into bed and say to yourself that you forgot to floss, usually your floss is most likely just a few steps away, and there is a better chance that you will go back and actually floss your teeth, thereby reinforcing and developing the desired good habit. Water, with a pH of 7, is alkaline compared to the acid that the bacteria in your mouth produces, which means water will have a buffering or pH balancing effect to the acid produced. So finishing your meal with drinking water makes sense. Remember, Your saliva is 97% water, and this alone should tell you the importance of water for your dental health. Remember the Swedish experiment where I explained how they fed sticky sweets to their patients? A very unethical experiment, but the Swedish people learned something valuable from it. It is better to eat sweets one day of the week than to eat it during the course of several consecutive days in a row. To the present day, the Swedish people are known to dedicate a non-working day as their day to eat sweets. We can all learn to implement that same lesson as well. May I add, I have several parents who take this to extremes by denying sweets altogether to their kids. I cringe every time when I hear this. Now, I cannot tell parents not to do this, but I always worry about these kids obtaining and hiding their sweets from their parents. And then the parents tend to find blame elsewhere for their cavities that their kids get. Enough said. My goal for me and my patients are to be in the top group of this Stevens curve. But in order to be at this level of dental health, you will need to have your teeth fully restored and to be cognizant of the foods that you eat, the acid being produced, and the plaque that you need to be removing off of your teeth.